Hello First Wellness family. I wanted to bring y'all a quick video today and kind of walk you through the process, at least what's going through my mind, especially for the new patients that come in. Haven't seen them before, and we're trying to figure out, obviously, for sure, 100% what's causing their pain. So the big question is, if we go through this process, at least for a couple weeks of treatment, and they're not responding to treatment. Kind of in the same ballpark are some people that come in or have tried chiropractic and they say chiropractic didn't work. So I'll be the first to admit, chiropractic's not going to fix everything. We really try to hone in and get an idea of what's causing the pain before we start treatment. Okay, that way we can get a better idea of our success rate. But again, we're not perfect. I'd probably, if I had to guess, I'd probably say 10% of the time, we go into treatment thinking that it's going to be an alignment issue, and it ends up being something else. But that's not too bad of odds. Just to give you an idea, come in for the first day, we do the exam, history, consultation, and x-rays if needed. We try to correlate the alignment with what you're feeling. Okay, if we see that correlation in there, or at least some correlation between your alignment and what you're feeling, then we know we can get at least some effect on the pain. Okay, which what our goal is, right? But even saying that, we go through a week, maybe 2 weeks, at the most 3 weeks, and we're doing some good work on the alignment. We're getting some really good correction on the alignment, but the pain is either staying the same or getting worse. Okay, well, after a week, my senses go up again. 90% of the time, we're at least going to have some effect on the pain. Okay, might not go away, but it's at least going to be getting a little bit better. Okay, kind of slowly walking it back into place. So if we get through a week, maybe 2 weeks, and we're still the same on the pain level, or it's getting worse, my alarm bells start to go off. Okay, because something's not making sense. If we saw a correlation between your alignment in the area that you're having pain, at least something should be happening with regards to your pain. So 2 weeks goes by, my alarm bells are going off, pain's the same or getting worse, and we go into that third week, maybe 3 weeks, and we're still not seeing any response in the pain and your symptoms. Then we go ahead and say, okay, let's do this. We're either gonna re-image, which means either do additional x-ray, okay? Re-imaging might also be doing MRI. MRI is going to be a lot more detailed as per x-ray, because x-ray is going to show us the bone in alignment. The MRI is going to show us all the soft tissues, the muscles, the tendons, the ligaments, the nerves, the disc spaces, or the discs themselves. Okay, so we get a lot more, we get 10 times the amount of detail on MRI that we do x-ray. And sometimes, something will pop up on the MRI that you couldn't see on the x-ray. So that's the re-imaging part. A lot of times if we do that re-imaging and something kind of looks fishy or funny on the MRI or even the x-ray, that's when we send over to, this is in that second to third week period, we send over to maybe an orthopedic or a neurologist to get a second opinion. Okay, not perfect, so a lot of times it's great to bring somebody else in. Get two heads are better than one. More often than not, we got a couple orthopedics that we work with. Dr. Jim Smith, Texas Orthopedics, really good guy. More often than not, he sends them right back to us and says, keep doing what you're doing. Let's see if we can give it a little bit more time to work out. And sometimes, I've had patients in the past, for whatever reason, more often than not, the misalignment's been there for so long, years, 10, 20, 30 years, that it takes us a good 10, 15, I've had a patient take us 20 treatments before we saw any significant reduction in their pain. Okay, and that's way outside the norm. Okay, but again, thought process of, let's give it a couple weeks, 2, maybe 3 weeks. If we're not seeing any results or it's getting worse, let's re-image, either x-ray, MRI, or include somebody else in on to get a second opinion, either orthopedic or neurologist. Because the last thing I want to do is miss something, and have something that's kind of hidden back there that's kind of getting worse when we don't have a lot of time to play around with. So that's kind of what my thinking is. When you're coming in, you can kind of keep that in mind too. That's our game plan. Let's get through a couple weeks, see if we make at least a little bit of improvement on the pain. If we're not, then we're going to figure out what's going on other than that. Hope that makes sense. If you have any questions about your case or anything else, y'all go ask in the comments below. Other than that, we got our contact information in the information below. So let us know. You can call us up and ask us a specific question on the phone. Thanks for joining me. Hope this video is helpful. See you next time.